Hello, I'm your host, Neil Howard, here on Health Professional Radio, speaking with Dr. Michael Blackman, Chief Medical Officer at Greenway Health. He's joining us to talk about navigating healthcare this brand new year and how Greenway Health is going to be at the forefront of some major changes having to do with patient care. Welcome to Health Professional Radio, Dr. Blackman.
Thank you. It's a pleasure to be here.
Give our listeners a bit of your professional background, and then let's talk a little bit about your role there at Greenway.
Sure. So, Neil, I'm a primary care doc by background. I did a residency in internal medicine and pediatrics, and I currently serve as Chief Medical Officer at Greenway, where I support our company's ambulatory care clients. I want to make sure that everyone's equipped with solutions and services that they need to provide outstanding patient care, and frankly, also continue to succeed in value-based care. I've been working in health IT for over 10 years and have over 20 years of healthcare experience. And I love what I do, frankly, because I get to help our clients use technology to improve care and, maintain their practice as they continue to move forward.
Now, of course, this COVID-19 pandemic has had a major impact on healthcare across the board. From your perspective, what are some of the biggest impacts on healthcare? And then looking ahead to this year, this 2021 year, how is Greenway at the forefront of some different support efforts?
Well, there's absolutely no question that COVID-19 pandemic has had a big impact on healthcare, as it has on all of our lives. And as we look at what happened, as we went through 2020 and now into 2021, practices are challenged. They're continuing to have differences in the way patients come in. Not as many patients coming in, which in large part facilitated the move to telehealth, a place where Greenway has made great strides in providing good support to our clients with an integrated telehealth solution to make it work within their workflow and support their patients. The other difference as we continue to move forward is changes in the payment schedules. But as when you maintain a practice, the most important thing in healthcare is taking good care of patients. That is first and foremost, no matter what one is doing. But a practice, especially a small practice, there's not much margin there. And if I could quote, Sister Irene Krauss, who used to run 6 hospitals, she's famous for saying no margin, no mission. And that's very true for, practices as well.
As far as telehealth is concerned, you talked about the support and the strides that you've made there. Obviously, there are situations where that's not really a viable route to take. How are you navigating some of the, fall through the cracks situations when it comes to some of the advances in telehealth?
Yeah, no, that's absolutely true. I mean, telehealth is a tremendous advance. It's been around for a long time, use often for, remote hospitals and other uses of that nature. But you're absolutely right. Telehealth is not appropriate for every single situation, but it is appropriate for a lot of them. Mm-hmm. And in the cases, where it's not, we're still, trying to make sure that our clients all have the tools they need to effectively manage patients. And frankly, simply by converting patients where telehealth is an appropriate tool, that decreases the number of people in the office, increases the ability to have social distancing there, and makes the office safer as a result.
There is a lot of talk surrounding the CMS final 2021 physician fee schedule. Give us a little bit of insight into that and talk about any updates that you're aware of.
Yeah, so one of the things, especially around telehealth, was a lot of the telehealth payment authorizations in 2020 were the result of some emergency waivers coming from CMS. The good news is that those are being continued into 2021, but also there are additionally about 60 new telehealth services that are reimbursable under Medicare, including things like psychotherapy and some psychological testing, and even home visits. Everybody's home visits have changed a lot. We've all gotten used to using whatever remote solution one likes, even when talking to family. In addition to that, though, there are some notable changes in the professional coding for physician visits, sometimes known as the E&M codes, which frankly we've been waiting for a long time as clinicians. These schedules were last updated in the late 1990s. And the big change there from a clinical standpoint is that the billing now much more aligns with the clinical value add of the visit, as opposed to just counting all of the documentation elements one might have put into a note. The note historically has tried to serve two purposes, sometimes contradictory. As you think about a note, most importantly, is a vehicle for good communication between providers to understand what's happening with the patient, and yet it's also a billing tool. The new changes have brought that more into alignment. Not going to say perfect, but certainly better.
You also mentioned converting some of those situations that aren't viable for telehealth into situations that are good for a telehealth situation. How is Greenway involved in changing the mindset of people who could do telehealth but are a little bit leery?
It's really talking to people and saying, let's talk about your practice, let's talk about what you actually need, and making sure it fits in the workflow. Nobody likes change. People say they want it, and then nobody likes it when they get it. Sort of a common human reaction. But if we really sit down and say, we can help you provide telehealth within your workflow in a way that doesn't disrupt care, you can move from a patient you're seeing in person to one you're seeing remotely seamlessly, that really works quite well. And we've heard from multiple clients about the ease of use of the telehealth solution doing just that.
Everyone is involved in this COVID-19 vaccine rollout. What has Greenway been doing to support this absolutely critical task, and what do you think Greenway's involvement will be going forward?
You know, Neil, you're absolutely right. The vaccine rollout is an incredibly necessary and also difficult task. So we've been working with our clients to make sure that their systems are set up properly so when they get vaccine, they can administer it appropriately, capture the data that's needed so that can be transmitted to, whether it's the CDC or a state registry. And for Greenway, we've been spending time with the EHR Vendor Association, which are us and other EHR vendors, working with the Centers for Disease Control to understand where they are, what's next, what's needed, so we can stay ahead of the curve in providing the necessary codes and other things to our practices that we work with, so that they're ready at the time they get the vaccine. Certainly, if we look at where we are now, there are a couple of upcoming vaccines in the pipeline. They're going to make it easier as the supply becomes available for the vaccines to be administered in ambulatory practices because they don't have the cold storage requirements of the first Pfizer vaccine, which is certainly a wonderful vaccine, just much harder to handle.
Michael, I'd like to get a website, online resources where our listeners can go and get lots more information about you and what it is that you do, and Greenway Health as well. Where can we go online and get that info?
Well, for about Greenway Health, and there's some information about me there as well, you can go to greenwayhealth.com. That's GRENWAYHEALTH.com. And for information about COVID and the COVID vaccine, I would always refer people to the Centers for Disease Control and Prevention website, which is cdc.gov.
Dr. Blackman, thank you so much for joining here on Health Professional Radio.
My pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Michael Blackman, Chief Medical Officer at Greenway Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.